Hi, I'm Dr. Brian Lawenda, and I'm a radiation oncologist at Genesis Care here in Kennewick, Washington. Skin cancer is the most common cancer in the United States, by far actually. In fact, 1 in 5 adults by the time that they're 70 years of age will develop a skin cancer. Fortunately, most of these are not lethal, and that's obviously just sort of a testament to the type of biology of these cancers. However, some of these cancers can be. And the statistic that we know is about 2 people per hour are diagnosed or actually die of skin cancer in the United States. And most skin cancers are due to ultraviolet radiation, either from the sun or from tanning beds. So it's really not a surprise when we hear that the data show that individuals who've had at least 5 sunburns during their lifetime actually have about a twofold risk of developing melanoma. Most skin cancers occur in the Caucasian population, with 35 to 45% of all cancers in the Caucasian population are skin cancers. However, skin cancer can occur in anyone, and 2 to 4% of all cancers diagnosed in the Asian population are skin cancers, 4 to 5% in the Hispanic population, and 1 to 2% in the Black population. Skin cancers arise from the epidermis of the skin, and that is the surface layer of the skin. That's where most of the squamous cell cancers can arise. Deeper to that, called the basal layer, is where you find the basal cell carcinomas, and also in this same location is where you find the melanocyte layer, which is the pigmented layer of the skin, and this is where melanomas develop. Actinic keratoses are the precancerous condition of the surface of the skin, again, the epithelial layer of the epidermis. And these can lead eventually to squamous cell cancer in many individuals. 58 million Americans are estimated to be living with actinic keratoses at this time. The 2 categories that we refer to when we talk about the main types of cancer, we talk about them as either melanomas or non-melanomatous skin cancers. Squamous cell cancers are approximately 1.8 million cases per year. Basal cell carcinomas are about double that, and melanomas are around 200,000 per year. And while melanomas are more lethal than the other 2 types of cancers, it actually turns out that more people die of squamous cell carcinomas per year just simply because of the sheer volume, the number of those cases. Skin cancer can develop anywhere on the body. Predominantly, it occurs in the sun-exposed areas, particularly in the scalp, the face, the neck, upper area of the chest or shoulders, sun-exposed areas of the arms, the hands, the legs, and the feet. However, it can also occur in areas where you may not expect, like on the soles of the feet, the palms of the hand, around the nails, around or actually in the eyes, which is why it's also important to see an eye doctor, not just for checking your vision, but also to look at the back of the eyes to see there can be pigmented lesions that occur there, and sometimes people can get melanoma actually in the eyes. Also the genital areas and other areas that are not typically exposed to the sun. To diagnose skin cancer, you have to do a biopsy. And so the 3 main types of biopsies that are commonly done, one is called a punch biopsy, which uses a tool that is cylindrical, as you can see here in this picture. And what that does is that removes a core of tissue that's then submitted to the pathologist to review under the microscope. The other 2 are excisional biopsy, and this is where a scalpel is used to remove a lesion, or a shave or scrape biopsy, which is where a razor blade is used to superficially remove a lesion. There are many possible signs and symptoms for skin cancer, and not all of these are going to be related to skin cancer. They can be related to benign conditions. However, it's important to be aware of these potential warning signs, such as an area of skin with scaling, a raised area of skin that may be shiny or pearl-like, a lesion on the skin that may be painful or itchy, a lesion that may be bleeding or oozing, a sore that doesn't heal in the normal expected amount of time. Or we also talk about the ABCDs. So this is, for example, when we're thinking of pigmented lesions or even non-pigmented lesions, we're thinking about possibly even melanoma. And we use the ABCs for the following. So let me kind of go through them. So A is for asymmetry, meaning that if you were to bisect the lesion in half, meaning if you were to draw a line right through half of it, one half may be different than the other half in its appearance. B stands for border irregularity, so there can be strange shape of the border around the lesion. C is for color, meaning changes of the color of the lesion or changes within the lesion, different types of colored spots around or different patterns inside the lesion itself. D stands for the diameter, which is where you're looking at actually the size of the lesion itself, greater than a pencil eraser or a quarter of an inch. And then there's also E, and E stands for evolution, which means change. So any type of change of that lesion over time is something that could be a concerning sign. If you have any of these signs or symptoms, or just simply have any questions about any lesions on your skin, it's really important to bring this up with your dermatologist or your primary care provider so that they can do an evaluation, clinical examination, looking at all of the sun-exposed areas that we've mentioned, as well as not missing those areas where the sun maybe isn't always shining, as we talked about before.